Dear friends, now having understood the clear steps of cataract surgery, especially the SICS technique of cataract surgery, then most of the questions for you will be to compare this kind of steps. What are the advantages and disadvantages in an SICS procedure when compared to an ECC procedure and when compared to a phacoemulsification procedure. So that will be a major questioning area. So we will dedicate one PPT for that particular portion. So first we'll have to be thorough about SICS itself. We have understood the steps of the SICS. Now objectively we'll try to understand what are its advantages and disadvantages. The first advantage, needless to say, though it is the commonest procedure now done in the whole third world countries for cataract surgery, it helps in high volume, high quality surgery. High volume, high quality surgery is very needed for a country like India, where there are millions and millions of people with blindness because of cataract, which is a preventable blindness or correctable blindness. All we have to is identify this patient, take him for cataract surgery. Once a cataract surgery is done and an intraocular lens is implanted, patient becomes perfect. So that is the need of the hour. So this SICS exactly fills that need, and creates a very good opportunity for doing high quality, high volume surgery. And there is a very short learning curve. There is no instrumentation dependence here. If you are learning an instrument and doing a surgical technique which is very instrumentation dependent, then it will have a long learning curve. But here there is a very short learning curve. Obviously this is sutureless, and so all the suture related problems like suture irritation, suture infection, suture removal, astigmatism, all these are avoided in an SICS. And cost wise it is very less. Post-op follow-up also is not much needed in these patients. If the patients usually are seen on the first POD and then preferably the third POD or the seventh POD, mostly it is enough because by that time the healing is almost done. And then probably the patient comes back after a month for a final checkup. That is the usual treatment post-operative protocol which is being followed. And even in remote areas, this can be done. Like you can conduct a camp anywhere, collect patients, bring them, mobilize them to a base eye camp, and in the base eye camp you can do the procedure safely after doing all the evaluation, instrumentation we discussed. No, all those have to be completed, and then the procedure can be done. So what are the disadvantages? One disadvantage is it is totally surgeon dependent. The hands of the surgeon is the only investment in fact needed for a good SICS surgery. And there will be some congestion because you are raising a conjunctival flap, and the conjunctival flap you are cauterizing, so there will be some amount of congestion. And because you are using something like a 6 mm wound, though there is no sutures, the wound per se will cause astigmatism. That is called the surgically induced astigmatism, or SIA. So these are some negative factors. But if you notice, the plus factors outweigh the negative factors in SICS, and SICS truly is a wonderful surgery used in cataract. Now we will compare this SICS with the other two competitors like ECCE before done in earlier days, and phacoemulsification done recently. So we'll compare this SICS with those two techniques. What is special with ECC? ECC, if you see, you are creating this big wound. Can you see? Almost 8 to 9 millimeter wound. Can you see this 8 to 9 millimeter wound? This wound is not a tunneled wound. And this wound will need suturing. Can you see those sutures here? One suture here, another suture here, another suture here. This kind of suturing is needed for an ECC surgery. This is one of the most disadvantaged thing about ECC surgery. Here you are creating sutures. Sutures will lead to infection. Sutures will lead to irritation, and sutures will lead to astigmatism. And sutures need to be removed. In fact, there is a common question: when will you remove these sutures? After 6 weeks. Remember this. You'll have to wait for 6 weeks because the healing period of cataract surgery is usually 6 weeks. 6 weeks. And in these 6 weeks, you'll have to wait. And 6 weeks, what do you give as medication? The normal medication which is given is an antibiotic and steroid combination of drug. Antibiotic steroid combination like moxifloxacin, dexamethasone, like that drop is given. And this is started at 6 times a day initially in the first week. Then next week it will become like 5 times a day, 4 times a day, 3 times a day. Like that you will taper it, and the drop will become over by 6 weeks. This is the usual treatment given for a cataract surgery. So in that treatment period, in that 6 weeks treatment period, you'll have to wait for the sutures also. You cannot remove the sutures before that. After the 6 weeks only, you can think about removing the sutures. Otherwise, the steps are same. You do you make an entry, then you do a capsulotomy. Then once you have done a capsulotomy, you do a hydrodissection of the nucleus and make it free. Then you prolapse, you express the nucleus. Here there is no prolapsing. Here you do a pressure counter pressure technique to totally express the nucleus through the wound. Then wash the cortical matter. Then place the intraocular lens, and then after having placed the intraocular lens, do a wash, do a thorough wash of the area. And once you have washed and placed the intraocular lens, then start suturing the wound. This is conventional extracapsular cataract extraction technique. Okay. So the next big contender for cataract surgery, or rather the best method, if somebody asks you which is the commonest method, say SICS. But if somebody asks you which is the best method to do cataract surgery, then say phacoemulsification. Phacoemulsification is a very wonderful procedure. It has very big advantages. Small incision size, only 3 millimeters, even less than 3 millimeters, 2.8 millimeters. Very fast rehabilitation, because the procedure is over 1 day, 2 days, the patient takes rest. Third day itself, patient can go for his regular work. That kind of yearly recovery is there in phacoemulsification. No stitches, obviously. Not even a block is needed. Most of the times, in good hands, phacoemulsification can be done just under topical anesthesia. Post-op congestion and all will not be there, because you are not touching the conjunctiva itself. You are making a clear corneal incision, entering the eye, doing the procedure, finishing it off. So you are not even touching a conjunctival flap or anything. And astigmatism is obviously very less, because the incision which is created is 3.2 or 2.8. 2.8, okay. 2.8 or 3.2 is the two incisions that are created. Both are very small incisions, so it will create less astigmatism. But the disadvantages obviously is the machine dependence, investment, because the machine is costly, so you have to invest. And the person who is going to learn this will have a learning curve. There will be a long learning curve, and especially in very hard cataracts. I told you, the cataracta nigra, cataracta rubra. Phacoemulsification is a very difficult technique, because if you do that much of phaco energy to do nuclear emulsification in these cases, then in that time the energy which is there will also destroy the endothelium, and thus create lot of problems for us. So this is the phacoemulsification plus and minus features. We have also seen SICS, ECCE and phacoemulsification now together. So I want you to remember that the best method is phacoemulsification. The most commonly done method is SICS, and ECCE is almost a method of yesteryears. It is no more done. So that is the story of cataract surgery today. So with that, we have had an overview of the techniques. So now you can answer questions which tend to compare them and ask you which is advantageous, which is disadvantageous. Those kind of questions I'm sure you can answer with the help of this PPT. Thank you.